Welcome to Invest Insights. I'm Abby Melone. I'm joined today by Todd Schonherz, the COO for Florida Cancer Specialists with 100 locations in the state of Florida. He joins us for our discussion on the COVID-19 pandemic. Don't forget to like this video and subscribe to our channel for more information. Todd, how has Florida Cancer Specialists had to adapt your business model and patient care due to the COVID-19 pandemic?
Yeah, unfortunately, I don't think anyone was actually prepared for this pandemic or even saw it coming. But at Florida Cancer Specialists, we've had in place an emergency response plan and team that really was able to react very quickly to the situation. Located in the state of Florida, we're used to dealing with natural disasters such as hurricanes, and our ability to implement plans that really was similar to that to ensure the safety of our staff and our patients was paramount. We have really focused on a number of areas. First and foremost is really how do we continue to ensure that we're here throughout this pandemic to take care of our patients. We've accomplished that through a number of means. First and foremost, we ensured our staff were able to come to work every day. They were provided the appropriate protective gear, including masks, gowns, face shields, etc. We've implemented all the necessary screenings per the CDC and Florida's Department of Health to ensure people that were entering our clinic were potentially not carriers or exposed to the COVID-19 virus. And then we did a lot of education for our patients as well. And that included what to expect when they entered our clinics. We protected our patients by providing them the necessary masks for treatment, so when they were in our clinic. We also did a number of things to help space out the visits to ensure that there was appropriate social distancing for our folks when they came in for a physician visit or for a chemotherapy encounter.
When we were talking prior, you told me that the new patient volume has actually gone down. What do you attribute to that, and what does that mean for the next coming months?
Yeah, unfortunately, even with this and all the precautions we took, we have seen a drop over the last 6 weeks of about 20% of new patients presenting into our clinics today. I think there's a number of factors that contribute to that phenomenon. One, I think people are personally staying home and not going in, whether they had scheduled mammograms, annual visits, checkups, whatever it may have been that typically may have triggered a biopsy or a scan or something that may have led to a referral to an oncologist. We see patients who are presenting with pains not necessarily showing up into the emergency rooms because of the fear of COVID-19 as well. So a number of contributing factors really of patients sort of being scared, preventing and not going in for those preventive services, and in turn not being diagnosed, and in turn being referred over to a Florida Cancer Specialist physician.
We've seen a lot of change in how patients are treated at this moment in time, specifically using telemedicine. How does that apply to Florida Cancer Specialists?
You know, when this pandemic broke, we really thought as a team, how are we going to adjust and how are we going to plan for this? And one of the key factors was to really reduce the volume of people coming into the clinic every day, to reduce exposure to our staff, our physicians, and our patients that we're treating every day. Our IT team did a phenomenal job and stood up a telehealth platform within 48 hours that we were able to deploy to over 200 physicians and another 210 advanced practice providers across the state of Florida. We were able to implement not just the technology, but more importantly, the SOPs that go with it to ensure that our staff knew how to address those patients and how to communicate with those patients, to make sure the patients knew from an expectation what was going to happen. Our billing teams were set up to really ensure that we can capture all those charges. And then 3, we really worked through a number of other technology glitches for patients who were not used to using telehealth as well. And all those things working together really, frankly, made a very successful launch. And as of this week, we've completed over 10,000 telehealth visits across Florida Cancer Specialists.
That is a large volume indeed. And are you experiencing any innovations that you're implementing that you think will still last post-COVID-19?
I think clearly telehealth will be something we hope to be able to continue. I think it's really demonstrated, and the government itself, where they announced new provisions for the acceptance of telehealth, the guidelines for when you could use telehealth in the billing, I think was something that frankly was a very positive that came out of the federal government and allowing us to utilize that. And that's something we really hope to be able to continue. I think secondly, how we respond and how we address to safety issues and ensuring an environment for our patients, while we've always made sure it's a safe environment, we've gone the extra mile over the last 6 weeks as well. And implementing new processes for cleaning, implementing new processes for how we handle paper in our clinics, and reducing the amount of areas where there potentially could be a contamination to a patient. So everything from removing collateral in our waiting room, such as magazines and pamphlets and brochures, to how we check patients in and having to use virtual check-ins now versus having patients sign in for visits. I think these are all, frankly, though, again, no one wanted to see this pandemic, but are really positive outcomes to our workflow and frankly positive experiences for our patients now who are coming into our clinics and continue to have a safe environment to be treated.
And should our viewers want to find out more information, where would you direct them?
I think the best place to go continues to be our website, which is flcancer.com. On that, you'll get the latest information as far as how we're addressing COVID-19, how to reach any of our offices throughout the state of Florida, as well as how to sign up even for telehealth encounters and visits with any of our providers. That I think would be the best place for your viewers to get additional information about our organization.
Well, thank you so much. That was Todd Schonherz, the COO for Florida Cancer Specialists. Don't forget to like this video and subscribe to the channel to watch more insights. You've been watching Invest Insights, and my name is Abby Melone. Thank you again, Todd.
Thank you.